Myself, Karthika is. I am currently studying the second semester of Master of Social Work at Rajiv Gandhi National Institute of Youth Development. As part of seminar presentation on the subject social work research and statistics, have been assigned on the topic explain the diagnostic research design with a suitable example. My roll number is MASW21R829. The seminar presentation is going to submit it to Dr. Babu Puchasar, Assistant Professor of Department of Social Work at RGNIY. So I would like to start the topic with the introduction part. So, what is diagnostic research? So, diagnostic research design is one of the type of research design that aims to examine the underlying causes or root causes for a certain situation or a phenomenon. So, the diagnostic research design will help the researchers to learn more about the factors that creates the troublesome situation, and also it endeavors to find out the relationships between causes, and also it suggests through doing diagnostic research we will also be knowing about various needs for the solution. Next, the diagnostic research designs characteristics. So, it is a very systematic process. It provides a solution to a particular social problem or social issues, and it guides as a future reference and intervention model also. Next is about the process of social work, diagnostic research design. So, the first step of diagnostic research is the inception of the issue. That means when did the issue arises, or in what situation this issue became more evident. That is step one. And while moving on to step two, it is about the diagnosis of the issue. That means what is the underlying causes of the issue, and what is influencing the issue to worsen. And moving on to step three, it is about the solution for the issue. Like what is working in the curing the issue, what can be the cure factor, and under what circumstance or situations does the problem seems to become less evident. This all are the process of social work, diagnostic research design. Moving on, let me take an example. So, the correct example for the diagnostic research design can be coronavirus pandemic. So, first we need to take the inception or origin of the virus. That means from where the virus started. So we can say that a new virus called severe acute respiratory syndrome coronavirus, that is SARS-CoV-2, it was identified as the cause of a disease. That outbreak that began in China in 2019. The disease is called coronavirus disease 2019, that is COVID-19. So in March 2020, the World Health Organization declared COVID-19 as a pandemic. So the next step is the diagnosis of the virus. That means what caused the virus and why it spreads. So while looking on to like it means that many health experts believes that the new strain of coronavirus likely originated from bats or any kind of bat colonies. So the first transmission to humans was in Wuhan, China. And since then, the virus have been spreading to person contact. And there are data such as the virus can be spread from person to person who are in close contact, and it also can be spreaded by respiratory droplets released when someone injected with the corona, coughs, sneeze, breaths, sighs, etc. And the coronavirus can spread when a person is exposed to small droplets or aerosols that stays in the air for several minutes. So the virus can also spreads if you touch a surface with a virus on it and then touch your mouth, nose, or eyes. But the risk of that kind of spreadness is very low. So this is about the diagnosis of the virus. That means what caused the virus and why it is spreading. And third one is find solution for the virus. That means what kind of medicines or vaccination is for the virus. As the health experts is taking many kind of steps to reduce the risk of infection from COVID-19 virus. So first is to get vaccinated. There are several vaccines which are available, and to get vaccinated is the first step, and to avoid close contact with anyone who is sick or they have symptom, and keep at least 6 feet away from yourself, away from the corona infected patients, and to avoid crowds and also indoor places that have poor airflow. Ventilation is poor. So when the ventilation is poor, the risk of spreading coronavirus is also high. And wash your hands with soap or water, or do sanitize your hands regularly. And wear a face mask. It is a compulsory where, in the hospital, while you're visiting hospital or any kind of public places, do wear your mask. So this is what the third steps or the third step which is followed, find solution for the virus. That means we are finding medicine or any kind of vaccination for the virus. So while looking on the diagnostic research, decide as a topic for the topic coronavirus pandemic. First, we have looked on to the inception or origin of the virus, and then we looked on to the diagnosis of the virus. Then we moved on to the solution for the virus. So we understood the root cause of the particular problem. Then we identified why it is causing, and then we also looking into the possible solutions for that particular issues. Uh, so hereby I am concluding my topic. Thank you everyone for watching. I especially thank Dr. Ramabu Pochaso, the Department of Social Work, JNMID, for giving such an opportunity platform to present ourselves.